Hi, everyone. Thanks for joining. It's good to see you online. Thanks for taking time to be here. I'm Jaren Day. I lead cyber research here at KLAS. And joining me today is Nana Ahwoi, the EY, America's Consumer and Healthcare Cyber Industry Group leader. So we're excited to jump into the findings of our recent US healthcare cyber resilience survey. So when we first partnered with to do this research together, it was really clear that we wanted to give healthcare and organizations a better idea of where the gaps were with cyber strategies and execution. So we didn't necessarily only survey security leaders for this report. We actually surveyed the broad leadership that has purview and ownership over cyber at their organization. Nana, I'd love to hear from your perspective. What were some of the roles that we interviewed as a part of this survey, and why is this research so critical right now?
Thanks, Jaren. I loved that our research included CISOs, but it also had CDIOs, CTOs, CIOs, CFOs, and even COOs in our respondents. And interestingly, their responses did not diverge, if at all, which underscores the importance of this area. There's really three primary imperatives that are driving why this research is so important right now, right? The one being the healthcare sector continues to be under intense and growing attack, shows no signs of slowing down. Matter of fact, a recent report that was released highlighted that the healthcare sector had more reported cyber threat incidents than any other US critical infrastructure industry. The second is that the healthcare sector holds the unenviable position of being the leading sector when it comes to a cost of a data breach per a leading research piece that has been done now for many years. And the third is, unfortunately, we've seen the impact of cyber in the healthcare space going well beyond operational impact to patient care delivery, as well as significant business disruption. And that has come through in our survey results as well. When we think about how long it tends to take on average per, again, another research piece for healthcare organizations to identify and contain healthcare incidents, it's far longer than the average of almost 9 months was what one research study highlighted. And so when you take into account the impact of delayed procedures, diverted patients, again, these used to be seen as doom and gloom and unrealizable impacts, but we've lived those in recent times as well. And so the stakes are quite high when we talk about cyber in our sector. And that's why this matters so critically for not just CISOs, but really healthcare executives as a whole.
Yeah, absolutely. You bring up such a good point where it's like they're happening, they're really expensive, and they're majorly disruptive. And clinical care is being impacted, is what we're identifying in this survey here. And the operations are having major impacts as well. So thank you so much for kind of sharing your perspective there. We'd love to jump in and kind of share what were some of the top three findings that we found from this research. And especially like this isn't for, specifically the security team. Like this information is for healthcare leaders to digest and to understand about, where they can get involved and how they can better support the CISO community and the CISO role within their hospital.
Absolutely. And I'd love to tee up a polling question, Jaren, if I may, because it is often said, right, that cyber is a board level priority. It is a top priority. It's on all the risk registers that are out there. But we all know that when pressure hits and budgets tighten, or even growth targets take over, like which levers does the organization actually pull to keep cyber from slipping down the agenda? And we have a couple of options here in the poll. One is around executive level tone. So is there a non-negotiable expectation for cyber, even if other initiatives may be delayed? Number two is a business impact requirement that any funding needs to be aligned or tied to hard financial, clinical, or operational outcomes in order to maintain its position on the agenda. Third being metrics and accountability, establishing key performance indicators, scorecards, or even compensation that's tied to cyber outcomes. Fourth option, reprioritization, where competing priorities may be paused or be deprioritized so that cyber and resilience investments continue forward. Second to last would be consolidation, where cyber is proactively embedded into initiatives that involve technology, data, geographic expansion, et cetera. Or the worst case scenario is we just let it slip, right? So when pressure arises, it has to move down and it moves down. Would love to see how the audience responds to this polling question.
Yeah, and I think it's as the audience is responding to that, I think it's really an interesting time for healthcare, specifically because we've got a lot of pressure happening around IT budgets. And there is, especially with the federal policy and the impact on Medicaid and Medicare, there is sometimes the tightening of the belt that happens. And right now, that's kind of the overall trend that we're seeing is the tightening of the belt. But then you look at the last year as far as what's happened in cyber, and we ask executives in our survey, we say, where does cyber sit in terms of your strategic priority? And 81% said, yes, we are prioritizing cyber in our business strategy. And 65% of the leaders in our survey said they also feel empowered to make cyber decisions. But then when you get down to it in the survey, only 52% actually had the final decision-making authority, which really shows the leadership paradox that we see here, because what we've seen is that everyone is saying, yeah, we want to invest in cyber. It's a strategic priority. We also have all of these other budget cuts and pressures that we're under. Where ultimately does cyber land then? And in KLAS's study recently that we've done, we found that cyber is really kind of probably number 4 on the list when it comes to strategic priorities and where people are investing at this time. So what that does is it creates this resilience gap where there's interest and there's authority, but the outcomes are lagging in terms of actually making cyber a strategic priority. And so you've got the will, but maybe sometimes you don't have the way. Right. So would love to hear kind of additionally what you've seen in the research, Nana, and around that alignment and bridging kind of the authority and tying it to some of the outcomes that we'd like to see in cybersecurity.
Absolutely. And I love that you called it the paradox, because that's effectively what CISOs are living on a day-to-day basis, right? And I would say that if I was to highlight one key call out, it's really around having some type of shared metrics. And you saw that as one of the options in the polling question that we raised, right? Are there KPIs, compensation, or even scorecards that really tie together the expectations of key stakeholders across the organization for really maintaining a focus on cyber? Because I bet you, Jaren, if we look at the 3 that are above cyber, all 3 of them likely have some data, tech, or even resource or people aspect to what is underscoring those priorities, which will be required for things to move forward, but it's not explicitly stated in the way that executives sometimes think through cyber. Within the firm, we talk about cyber for cyber's sake, and then cyber in everything that we do. And I think that the research that you're referencing really underscores the opportunity for us to think about cyber in everything that we do, and not just think about it, but follow through with it, and then have a way to hold key stakeholders accountable for being able to drive the cyber priorities forward. Because to protect the investments that are being made in the top 3 priorities, or even the continued operation of a business and ability to deliver care, we need to have robust cybersecurity capabilities. And individuals like you and I can't work if we don't have identities, as an example, right? And the way that the identity ecosystem is managed is through a cybersecurity capability. So I think that those are opportunities that we have to really shine a light on how cyber is core to the business and business operations and strategic priorities.
Yeah, and one of the key themes that we heard as well through this survey was that cyber didn't necessarily need to be a CISO only responsibility. It's a team sport here, and that there is a need for shared accountability and consistent leadership engagement in order to realize and get to some of those outcomes that you are talking about. We're looking at the CFO being involved in decisions now and the board being involved in some of these decisions. And they're trying to figure out, which lever do we pull from an investment standpoint and when do we bring in cyber to help us. And you mentioned the identity piece, and that ended up being a major theme that we heard within the report in areas in which there is ongoing investment. And I believe we had the number here, it was like 68% of the leaders that we interviewed as a part of the survey said that, identity and access management was a top priority of investment this year. And as we went through and we did the survey, we also did an executive forum where we spoke with security leaders to help us kind of really understand the environment of what they're going through. And what we learned was that identity is really this new frontier and this new perimeter for organizations. There was a story shared about how the help desk verification is becoming an area of interest for attackers to come in and pretend to be physicians to get their password reset so that they can just log into the system. And it's creating a new challenge for organizations, as well as also with the rise of agentic AI and automation and bots having individual identities and access to information in a health system. It's creating such a new, interesting challenge for security. We'd love to hear kind of from your perspective, how have you seen from the survey the shift to identity being a major focal point for healthcare?
Yeah, Jaren, the identity space is an interesting one, right? Because it is a space that many organizations have continued to grapple with for years, and some of the stats that you highlighted are only further exacerbating an already complex situation that organizations are trying to wrap their hands around. I saw a recent stat the other day that stuck with me, and it mentioned that health systems now have between 10 and 50x machine identities in their environment than human users. And just think about that, right? And it highlighted that most tend to have more privileges than are needed. There's not always the monitoring that needs to occur around it. And if there's any credentials, they're often not rotated on a periodic basis, right? And so these are all opportunities for threat actors to compromise these identities, in addition to the human ones that you highlighted when someone calls the help desk to try to get a password rotated, right? So identity really is the heartbeat of an organization. And we see clients continuing to focus on really strengthening the governance that they have around identities, understanding what are all the identities in their ecosystem. Again, this is a challenge that exists today and is just getting more challenging to manage through. So I'm seeing prioritization of account discovery as part of an organization's identity initiatives. They're also looking at things like behavioral analytics. So if you see behaviors that just don't seem aligned to what you would expect in an organization, having mechanisms to detect that and kind of flag that for additional review. We've talked around, rotating of credentials and making sure that those credentials are appropriately managed. Organizations are also looking at things like just-in-time or even conditional access, so that it's not a persistent level of a heightened level of privilege, but it's only as and when needed. The other thing that I would highlight in the identity space is a focus on expanding the governance. When we talk governance, it's not only what happens in the four walls, it's also around vendors that are operating in the ecosystem, in addition to the other parties that may be connecting in some way within an organization. So again, it's just a critical area. And so I wasn't surprised to see it rise to the top as one of the primary areas of focus, particularly for healthcare organizations, given what's been happening in our environment today.
Yeah, like you bring up a good point, and the environment is shifting and changing. And from the executive forum, we even heard from some of the security leaders that you as a healthcare leader, you may now be responsible for to be an owner of a specific identity over a bot or like an agentic AI. Like individual leaders may be an owner over that particular identity moving forward to make sure that there's accountability around it. And it bodes the question around kind of what's happening in this space, that we're seeing all this innovation,
Mhm.
right? And we're seeing all of this investment in Gen AI. Most of it is in pilot mode still today, but whether it's in pilot mode or whether it's actually realized and implemented, it still has access to the organization, right? We're giving large language models, Gen AIs, access to a lot of data and information, which can create systemic risk if it's not managed appropriately. And so um, ultimately, though, we see healthcare kind of diving in and going in this direction, but it can create a challenge because you've said it yourself before, like implementing AI like this without considering cyber up front is like buying a car without having the seat belts. You know, that's kind of risky. And some organizations are moving quick because they don't want to slow down the innovation. But we've seen in our study here that cyber can actually be an enabler of safe innovation to help you scale safely and
Mhm.
adopt some of these Gen AI solutions. Um, you've said yourself that there needs to be a mindset shift here, and I'd love to kind of learn a little bit more about the mindset shift that we found in the study. You know, changing cyber to be not just a compliance checkbox, but like a value creator for the organization. Tell us a little bit more about that.
Yeah, I would say that underpinning a lot of these innovative ideas is often the use of data and technology in some way or even geographic expansion, right? And in order to realize the outcomes that organizations are looking to see in those areas, there's an assumed level of continuity, right, which is underpinned by robust cybersecurity capabilities. And we've talked for years about cyber being embedded in critical strategic processes, business planning, as well as development life cycles up front, because then there's the ability to look at what you need to consider, right? Minimize the cost of remediation that might come up later on in a process if cyber is not included from the jump, or missing a key requirement that is necessary for an organization to expand into a new geography, or even taking out friction in a process because you're trying to have users have the ability to operate in a specific way across, the technology ecosystem in which they are performing their key responsibilities. And so cyber really has a unique position that is often not highlighted enough, in my opinion, which is around the value creation side of the house and how they're able to help drive efficiencies in the process, user experience, right? Try to drive user experiences in a more positive way, or even contribute to in this era where there's a lot of cost pressures, technology optimization, right? Taking out some costs, or at least reducing costs that may otherwise have to be spent if there is an approach that isn't considered upfront when these businesses are embarking on these creative journeys within their organizations. And so those are, a couple of areas that come to mind when we think about cyber as a business enabler, and us being able to tell that story, right? Highlighting some of the statistics of how cyber has been able to drive value, and then quantifying that in some way with some hard metrics, right? Whether it's tied back to, again, the user experience, efficiencies and processes, or even speed to market in some cases, depending on what we're talking about.
Yeah.
So, Jaren, I'd love to do a quick poll, if that's
Yeah, let's do
okay,
it.
because I would love to get some perspectives from the audience of, what would most solidify this perspective that cyber is, goes beyond the protective function, but it's really a true enabler of innovation and transformation in healthcare, because it's something we've talked about for years. I'm very interested in what is going to help to solidify that perspective. So a couple of options here in front of you. Option one is demonstrated faster time to market, where we see new digital AI solutions go live faster because cyber was built in early. Second, being better patient or clinical experience with clear data that confirms that the secure design actually improved the user experience, right? Increased trust, and then there's more reliability in the process. Third, stronger return on investment and business outcomes data, highlighting things like we reduce downtime, there's a lower cost of remediation or redesign or even re-implementation or rework or operating costs. Number four, enablement mindset with a cyber team that solves problems and is not seen as a blocker. And the last, which I hope nobody selects, would be that there's no confidence in this outcome. Would love to see what people think it's going to take to solidify the perspective of cyber as a business enabler, because we do talk about it quite a bit, and it's where we are continuing to work through as a discipline, Jaren.
Yeah, no, I love the poll because it really highlights some of the key themes that we saw from the report as well. That cyber needs to be tied to those tangible business outcomes, because it truly is. Like, it's impacting patient care delivery.
Yeah.
So when we're communicating and talking with leaders like you around cybersecurity and what impact it's having, tying it to those business outcomes around safe care delivery, reducing downtime in the event of a cyber event, connecting cyber to the patient experience. What we've seen is that cyber isn't necessarily just a cost center for organizations, depending on how you approach it.
That's right.
Because if you approach it appropriately and have shared accountability across your leadership organization, and then cyber can then be a catalyst for transformation and innovation in your org. So
Jaren,
we just want to
especially
say,
in one last comment, because we often talk about AI for cyber and cyber for AI, right? Especially as we talk about innovation, AI really is the current right now that underpins a lot of what organizations are exploring. And so it is going to be imperative that cyber remains considered as a core part of discussions as well as initiatives that are anchored in that space in particular, in addition to all the work that I know many organizations have continued to work through prior to the advent of AI and will long continue after this era in which we are as well, Jaren.
Yeah, absolutely. Well, thank you so much, Nana, for taking a few minutes to join us today. And we really we want to thank everybody as well for joining and participating in the poll. There are a lot more insights that is in this survey. We'd love you to go check it out. We've got a QR code right here after the webinar ends, and you can also reach out to either one of us if you have any questions or any feedback or anything you'd like to see in this type of research moving forward. Thank you so much for joining us today.
Thank you so much, everyone. Thanks, Jaren. Have a good one. Bye, everybody.
Bye.